Hello, everyone, and welcome to our module on venous pressure tracings. Okay, let's start by talking about what we mean when we use the term venous pressure. So if you look at my cartoon drawing of the heart on the screen here, this structure here is meant to depict the right atrium. And as you probably know, it receives venous blood from above via the superior vena cava and from below via the inferior vena cava. Now, there are no valves or other obstructions between the right atrium and the veins like the IVC. So whatever the pressure is in the right atrium at any point in time, that's actually representing the pressure in the entire venous system of the body. So when we say the venous pressure, we're really talking about the pressure in the right atrium. And if you took a pressure catheter and measured how the pressure in the right atrium changed over time through the cardiac cycle, you would get a graph like what's shown on the right side of the screen. Time is here along the x-axis, pressure is here along the y-axis, and the right atrial pressure or the venous pressure, remember they're the same thing, they always show these little bumps like the A wave and the C wave and the V wave. And so in this video, we're going to talk about this curve right here and what all these little ups and downs mean in terms of what's happening in the vascular system as a whole. So now let's go through this slide and talk about what all these little ups and downs of the venous pressure or right atrial pressure tracing mean. So let's start right here. The pressure inside the venous system, inside the right atrium, is climbing. And that happens in this part of the venous pressure tracing curve because the right atrium is contracting. This is compressing the blood in the chamber, causing the pressure to go up. And it goes all the way up until it hits a peak right here. Then the right atrium starts to relax, so pressure starts to go down. And we call this little bump right here the A wave. This wave is created because the right atrium contracts and then begins to relax, allowing pressure to fall. As pressure is falling in the right atrium during this portion right here, eventually it hits a point where the pressure gets so low that the tricuspid valve closes. Remember, when pressure is lower in the right atrium compared to the right ventricle, that will force the tricuspid valve to close. And that's what happens right here, and it creates this little bump called the C wave in the venous pressure tracing. Then we have continued relaxation of the atria, causing the pressure to fall until it reaches a low point right here. At this point, the right atrium has relaxed as much as it's going to relax, and the right atrium is starting to fill with blood from the veins in the body, and that's causing the pressure to rise. Now, eventually, the pressure gets so high that it opens the tricuspid valve. When pressure in the right atrium is higher than pressure in the right ventricle, that will push open the tricuspid valve. At that point in time, blood starts to leave the right atrium, leave the venous system, and it leaves behind a peak in the tracing called the V wave. And that V wave occurs because the tricuspid valve opens, causing pressure to start to fall. Okay, and then I've cleared away my ink so I can show you two other findings on the venous pressure curve. So this portion of the curve right here where pressure is falling in the right atrium in the venous system, we call that the X descent. And then this portion over here where blood pressure is falling in the venous system, we call that the Y descent. The X descent is caused because the atria is relaxing, so blood pressure is falling. On the other hand, the Y descent occurs after the tricuspid valve opens, when blood is leaving the atrium and heading into the right ventricle. And so down at the bottom right side of the screen, I've shown a handy mnemonic you can use to remember all these things about the venous pressure curve. So remember the A wave is atrial contraction, the V wave is venous filling, the C wave right here is caused by the tricuspid valve closing, and then the X descent, which we talked about is right here, is from atrial relaxation, and the Y descent is from emptying of the atrium through the open tricuspid valve into the right ventricle. Let me make a couple points about the tricuspid valve. So remember, the C wave is caused by closure of the tricuspid valve. So that valve closes just as the C wave begins. Then remember, when the V wave peaks out and the Y descent begins, that's when the tricuspid valve opens and blood is leaving the right atrium for the right ventricle. So by looking at this curve, we can define the period between when the tricuspid valve closes and opens and then when it closes again. Right after the tricuspid valve closes, there's no filling of the right ventricle. Obviously, the tricuspid valve is closed, and the right ventricle is starting to contract and push blood out into the body. Over here, after the tricuspid valve is open, now the right ventricle is filling, and we're in the right ventricular relaxation phase. And so I tell you this to let you know that you can correlate what's happening with the right atrium and the right ventricle from the findings on the venous pressure tracing. You should also know that everything in here is systole. Remember, in the EKG, the QRS complex defines the beginning of systole. And then everything over here, this is all diastole. So we can identify systole and diastole from the findings on the venous pressure tracing. And then I just want to point out that Wigger's diagram, which I talk about in detail in another video, has the venous pressure tracing as part of the diagram. So using Wigger's diagram, you can correlate events like the A wave or the V wave with all sorts of other things like the EKG or the heart sounds or the volume in the left ventricle or all these pressures up here at the top of the chart. I'll finish this video by showing you 4 classic pathologic findings that you can see in the venous pressure tracing, and those are the 4 findings shown on the slide here. Let's start by talking about a large A wave. So remember, the A wave represents contraction of the right atrium, trying to push blood past the tricuspid valve. Well, if there's tricuspid stenosis and it requires more pressure to open the tricuspid valve and push blood past the resistance of that tricuspid valve, then that's going to make the A wave very large. And that's the finding that you get in a patient with tricuspid stenosis. This is what it looks like on the right side of the screen here. This is the large A wave. Now you should know that interpreting these types of pathologic findings is extremely difficult. It's cardiology board exam level stuff. So I wouldn't worry too much about being able to recognize the pressure tracing, but you definitely should know that the large A wave is a classic finding in tricuspid stenosis. The Cannon A wave is a finding you get when there's AV dissociation. This occurs when the atria contracts. Remember, that's what normally causes the A wave. But when it does this, the tricuspid valve is closed, and that only happens if the atria and the ventricular contraction are out of sync for some reason. Anytime AV coordination is lost, that's when you can get a Cannon A wave. And the 2 classic conditions to do this are, first of all, AV dissociation, like in patients who have 3rd-degree heart block. And the other classic place to get this Cannon A wave finding is in a PVC. So when a patient has a premature ventricular contraction, that contraction will close the tricuspid valve. And if at the same time the atria contracts, that creates this sudden Cannon A wave. And that's the finding shown here over on the right side of the screen. Okay, the next finding is an absent A wave. That's what you get in atrial fibrillation. So remember, to generate an A wave, the right atrium has to contract. If the atrium is fibrillating, it can't contract, and therefore it doesn't generate the A wave. So you get a finding called an absent A wave, which is what's shown on the right side of the screen here. The waves are labeled. You've got the C wave and the V wave. The 2 descents, the X and Y, are there, but there is no A wave. That's an absent A wave, and that's what you get with atrial fibrillation. And then finally, let's talk about the giant V wave. So remember, the V wave is caused by contraction of the right ventricle. Well, if the right ventricle contracts, but a whole bunch of blood goes backwards through a regurgitating tricuspid valve, then that's going to make the V wave get very high. And that creates a finding called a giant V wave, classic finding in the venous pressure or right atrial pressure tracing in a patient with tricuspid regurgitation, caused because the ventricle is contracting and creating this very large giant V wave by pushing blood back through the leaky tricuspid valve into the right atrium. So I'll finish with this page of 4 high-yield findings to know about. We talked about the large A wave from increased atrial contraction pressure. You can see this in tricuspid stenosis. You can also see it in patients who have very high pressure in their pulmonary arteries, so patients with right heart failure or pulmonary hypertension. The Cannon A wave occurs when the atria contracts against the closed tricuspid valve. You see this in complete heart block, PACs or PVCs. You can also see this in ventricular tachycardia. Then the absent A wave always means no organized atrial contraction. This occurs in AFib. And as we just talked about, the giant V waves are seen in tricuspid regurgitation. And then I just want to finish with this slide and let you know that the pressure in the left atrium also goes up and down, just like the pressure in the right atrium, and creates an A wave, a C wave, a V wave, and an X and a Y descent. In this case, the C wave is caused by closure of the mitral valve, not the tricuspid valve, but otherwise the waves and the descents are all the same. So we don't usually measure pressure in the left atrium. It's much harder to do. It's much easier to measure pressure in the venous system or the right atrium. But if you do put a catheter in the left atrium, which we do in some rare circumstances, the pressure tracing will have a curve just like this, very similar to the one you see in the right atrial system. And that concludes our module on venous pressure tracings.